Remember Mabel and Sam? Mabel having end-stage congestive heart failure, who was very sick, and Sam with beginning dementia at 87, caring for his 85-year-old wife. Let me tell you what we can do for them now. From our Robert Wood Johnson research, we created a program called At-Home Support to meet the needs of Mabel and Sam. This model of care provides support and crisis care at 3 o'clock in the morning. Sam has someone to call, and he talks to a real nurse at 3 o'clock in the morning, who is able to help manage some of those symptoms because they have 2 computer screens with medication administration and the electronic medical record of Mabel. If we can't help via the phone, we send someone into the home to help manage that crisis. And whenever possible, to keep Mabel out of the emergency room and that whole cycle of hospital, rehab, home care. We stop those cycles and in the process improve quality of care for Mabel and decrease the caregiver burden for Sam. We also help Mabel and Sam when it is time for hospice to have those caring conversations. And instead of Mabel having hospice for the last 2 to 4 days, she's able to have hospice care for the last 2 to 4 months at Hospice of Michigan. And then Sam is able to have 13 months of grief support after Mabel's passing. This is quality of care. It's also cost-effective care, and it's beginning to change the healthcare system that has never been a system. It's been a non-system. We are filling that gap so that now there is a continuum and a system of care for the people that are the most vulnerable and need us the most.